Now, let's get this started with our curtain raiser startup showcase entitled AI in Skin Cancer. How SkinVision has detected over 30,000 skin cancers by transforming your smartphone into a medical device. Here to share her thoughts, we are delighted to welcome Loes van Egmond, Business Development Director at SkinVision. She's passionate about the intersection of health and digital, shaping innovations to improve the quality of life in the most cost-effective way. At SkinVision, they empower everybody to monitor their skin and check suspicious skin spots. Loes, over to you.
Thank you, Femke, and let me go ahead and share my slides with you. Let's see. Yes, so thanks everybody for joining me on the virtual stage today. I'm afraid I'm here to share a stark story about skin cancer and how it has developed into an epidemic. Now, before you tune out because you're tired of hearing stories about epidemic, let me also tell you this is a story about hope. So please bear with me for the next 10 minutes. First, I'd like you to meet Nikki. Nikki is a 46-year-old mom from the UK, and she has a skin spot on her ankle, which she never really noticed before, and in a different world may have never gone to the doctor for it. Luckily, she came across SkinVision. She read about us in her local newspaper, and she trialed our app on a skin spot on her ankle, and it was immediately flagged as a high risk by our machine learning algorithm. Our recommendation was to visit a doctor. Within 2 weeks, Nikki found out that she indeed had melanoma, the most aggressive and potentially life-threatening type of cancer, skin cancer. Nikki is not alone. Skin cancer has emerged as a major challenge to public health. It's known that 1 in 5 people will develop skin cancer over the course of their lifetime, making it the most common type of cancer globally. It's also one of the most commonest reasons to visit a GP, and every GP sees about 7 suspicious skin spots on a weekly basis. Now, in many countries, the GP serves as a gatekeeper, and they are trained on many different specialties. And they only receive about 2 weeks of training on dermatology. And this includes acne, psoriasis, acne, and the likes. So you can imagine that they really struggle to properly diagnose these skin spots. And on top of that, there's a shortage of dermatologists. For in the UK, for instance, there's only about 500 to 600 dermatologists, whereas we need at least 1,500, so another 1,000 to properly service the population. The funny thing with skin cancer is that it actually can be treated really well, as long as it's diagnosed early. Even for melanoma, the most aggressive type of skin cancer, we know that the 5-year survival rate is 95% for stage 1 melanoma. However, us, laymen, patients, are notoriously bad at properly diagnosing or assessing our skin spots. And we know that for every skin cancer that's diagnosed, there's another one that was not flagged as suspicious by the patient. So these are the cases where a patient represents themselves for lesion A, and the dermatologist actually diagnoses skin cancer on a different spot, lesion B. We also know that the prognosis dramatically drops if we delay treatment or detection. So for melanoma, a treatment delay by just 4 months already results in a 41% drop in 5-year survival rate. So we conclude that 1 in 5 of us will develop skin cancer at one point in time. And in order to get the best prognosis, we need to check our skin on a regular basis and make sure that we find it in time. Now let me pause for a pop quiz there. When was the last time you actually checked your skin? And I'm not talking about occasional checks in the shower here. I'm talking a full body check on yourself and monitoring your skin spots over time. I'm guessing it's not every 4 weeks like it's recommended by the Euromelanoma. If we look at the current situation, COVID is adding fuel to the fire. What you see here is a graph from a scientific study that was published earlier this year. It's data from the Netherlands, one of the few countries that actually has close to real-time insight in the number of cancer diagnoses. These lines are the number of cancer diagnoses compared to last year. And what you see here is the start of the COVID epidemic. And the blue line is the percentage of cancer diagnosis over time compared to last year for all of the cancer types apart from skin cancer. So we see that there's about 70% cancer diagnosis compared to last year. If you look at the red line, which is skin cancer, it even dropped to 40%. So what we see here is an effect of the corona crisis on other types of healthcare. And people are delaying their visit to the GP, especially for a suspicious skin spot. They might say, it's not so urgent, it can wait a couple of months. But we know 4 months delay makes 5-year survival rate drop by 41%. These late-stage treatments are also putting the affordability of healthcare under pressure. Now, I don't have to tell you about the continuous debate about the rising cost of healthcare. If we look at skin cancer specifically, there's an interesting study that's been done in the Netherlands. And what you see here is a forecast of the skin cancer cost in the Netherlands, and it's expected to triple by 2030. This is mostly driven by expensive late-stage therapy. These immunotherapies are amazing and they deliver great results for the patients, but they come at an expensive price tag of 200,000 euros a patient. So there is a way to flatten the curve, and the solution is early detection. Now, I promised you a story of hope. This is SkinVision. We transform your smartphone into a medical device that is as accurate as a dermatologist. And we empower everybody to check their skin and have a reliable risk assessment from the comfort and the safety of their own home. We are a CE marked medical device and we comply with all of the different regulations. So how does it work? So you pin a spot on your body and you let us know which spot you want to check. And then you open our smart camera, which automatically runs a number of checks to make sure that the quality is good enough. It's then immediately submitted to our machine learning pipeline, which is analyzing it on any signs of skin cancer. And within 30 seconds, you'll receive your risk indication, including recommended next steps to take. It's that simple. At the core of our app is our convolutional neural network. It's an algorithm that we've developed over the last 9 years. It's good to know that we've acquired over 3.5 million skin spots in our database, and they're all user-generated. We use this database to continuously train and improve our algorithm. And the last scientific study from last year, September, shows that we have a 95% sensitivity with a 78% specificity. And just to put this in perspective, this is at the same level as an experienced dermatologist. So how do we deploy our service? Well, anybody can download our app in the App Store and pay for it themselves. But we really believe in partnerships with health insurances. And it's probably best to explain this as with a case study that we have in the Netherlands. In this partnership with the health insurer, we have over 80,000 people who registered for our service. And it's not just the youngsters. 60% of these users are older than 50. Collectively, they've checked over 200,000 skin spots. That's probably around the same volume that 20 dermatology clinics would do. The vast majority, 80%, received immediate peace of mind. And they don't have to take time off to visit the doctor or anything like that, and they immediately have their answer. The people with a high risk receive follow-up and guidance from us. And out of these high-risk users, we've identified over 625 skin cancers, including 125 melanomas. In these partnerships, everybody wins. The patients receive a convenient tool that they can use anywhere, anytime, from the comfort and especially also safety from their own home. The GP and the dermatologist receive fewer consultations for obvious benign lesions, enabling them to spend more time with those patients that are at risk. And the payer realizes significant savings because they have to spend less money on late-stage treatment or unnecessary health consultations. Now I'm calling on you because we need to act now. Still, every day, 180 people globally die from skin cancer. And it's estimated that over 86% of these deaths are preventable. That sums up to 56,000 lives that are at stake. And we need people like you who are attending these kinds of sessions, affinity with healthcare and innovative minded, to drive the movement forward. So please join our movement. You can do that by 2 ways. First of all, you're very much invited to experience SkinVision yourself. We've created a promo code that is valid only today. So if you download our app and you enter this promo code in the settings menu, you can enjoy 7 days of unlimited access. Secondly, you're very welcome to reach out to me because we want to increase our reach and make sure that everybody has access to our solutions. So if you want to offer digital skin checks to your patients, customers, or employees, please don't hesitate to reach out. Thank you.
Thanks, Loes. If you have any questions after this truly inspiring story of hope, please follow Loes into the networking lounge and the speaker Q&A room. The link to that room is going to be dropped now into the session chat on Hopin. So please follow her there, where Loes can turn her camera and audio on, and you can type questions in the session chat for her to read out and answer. Please do try some one-to-one networking as well via the networking tab. And be sure to add yourself to our WhatsApp group. Simply head over to the sessions area, scan the QR barcode, or enter the lounge and click to the link to join. It's very easy. We're taking a short break now, and we'll be back with you shortly. See you in a minute.